Healthcare systems around the world face significant challenges in achieving the quadruple aim for healthcare. That is, improve population health, improve the patient's experience of care, enhance caregiver experience, and reducing the rising cost of care. Aging populations, growing burden of chronic diseases, and rising cost of healthcare globally are challenging governments, payers, regulators, and providers to innovate and transform models of healthcare delivery. That's when the application of technology and AI in healthcare has the potential to address some of these demand and supply challenges. Hello, everyone. Welcome to the Analytics Insight podcast, where we explore the cutting edge of technology. And I'm your host, Priya Dayalani. AI is perhaps the most transformational technology of our time, and healthcare is perhaps AI's most pressing application. Now, this was said by Satya Nadella, Chief Executive Officer of Microsoft. I think eventually AI in medical diagnosis is transforming the field of healthcare, offering new levels of accuracy and efficiency. Today, we have Masaharu Morita, founder and program director at NURA, to explore the various ways AI is reshaping medical diagnostics with a focus on its application, benefits, and challenges that come with integrating these cutting edge technologies into clinical practice. Hi, Morita, how are you doing?
Yeah, very good. Thank you very much.
Great. It's a pleasure to have you on our podcast today, Morita. And of course, when mentioned that AI is a transformational technology and healthcare is at the forefront, is one of the industries is that is at the forefront of embracing this technology, we have a lot to discuss today in our discussion. But before we get started, let our listeners understand more about your company, that is NURA. So, if you could give us a background about NURA, its specialization, it would be great.
Sure. Thank you very much for your introduction. My name is Morita. I'm working in a Fujifilm around 20 years. Actually, this NURA is come from Fujifilm company. Fujifilm is a Japanese company in the old, one of the old company, 100 years old already. So Fujifilm has medical equipment like CT, MRI, X-ray, AI, IT, everything, this kind of medical equipment. We are one of the biggest medical equipment company in Japan. So before we sold medical equipment to the hospital, but we recently bring this technology to the prevention area, preventive healthcare. Because, for example, in Japan, it's basically annual health checkup is there. So with this annual health checkup, we can find at the very early stage of the cancer and the early stage of the diagnosis, like a diabetic and heart attack, we can find that before happening. So this kind of preventive culture is not existing in India. So that's why we, Fujifilm, decided to bring this technology to create this kind of preventive healthcare by ourselves. So this is a start of NURA. Actually, NURA is one of the arm of Fujifilm Group. Yeah.
Great. Thank you for that wonderful overview, Morita. And we do have a better picture of the company Nura and the kind of impact it's creating in the healthcare sector. Let's dive a little deeper into your role, Morita. I mean, in earlier in 2020, you developed a new solution for tuberculosis screening, portable X-ray, and AI, and signed a long-term contract with the United Nations and make program with Global Fund. Having said that, I guess you have also developed and launched other such cutting-edge products and innovations and introducing new advancements in the healthcare industry. So, can you tell us more about yourself? How has your journey been till date? And what exactly is your role at Anura today?
Yeah, as I said, I'm working already 20 years in Fujifilm. Start from the beginning. Basically, Fujifilm, as I joined as a sales and marketing. So I sold our equipment to, especially for Middle East and Africa. Because I moved from Japan to Dubai to handle Middle East and African countries. At that time, I could find a lot of missing piece, let's say, in healthcare. For example, many tuberculosis is happening in Africa, and many people died. And for example, even cancer, diabetic, and heart attack, many treatable disease is not treatable in these countries because it's a very late finding. So from this kind of area, I stopped to think just to sell the equipment, but create something new, good things with cutting edge technology in this region. So that's why we made a very small type of X-ray and then to TB, tuberculosis screening in African countries, for example. And after that, it's not only TB, but also now many people die with cancer and lifestyle disease. So why not us to find this kind of disease by early stage? But unfortunately, this kind of screening center is not existing. So that's why we established this NURA screening center. So Fujifilm is a basically is a technology company, but not only stopped by technology company, but provide something new to create something new world by technology. So this is what we are trying to do that, yeah.
Lovely, Amrita. Now, it's of course very fascinating to hear how your role has been instrumental in driving the company's vision forward. And we are always glad and inspired to see how leadership and innovation can come together and create some real impact across different industries. Now, speaking of impact, let's dive in deeper into the evolution of AI, which has been pretty much transformative, especially in the field of medical diagnostics. Initially, AI was primarily used for administrative tasks, but its role has expanded significantly. Today, AI and machine learning algorithms analyze vast amounts of data quickly and accurately, assisting healthcare providers in making more informed decisions. And these technologies can also process medical images, recognize patterns, and even predict disease outcomes, transforming the practice of medicine. So I think AI today has become a powerful partner in healthcare, particularly in diagnostics and preventive medicine. How would you describe the current state of collaboration between doctors and AI technologies?
Yeah. So AI is one of the technology, I can say. It's not everything. How to utilize this technology? This is what we are always thinking. And also, actually, working in a Fujifilm, so R&D team also next to me. So whatever required for the society, we can create in Fujifilm, and we can bring to NURA to socialize or like democratize this solution in the world. So this is what we are doing. For example, health screening is what? Basically, if people have some sick or some abnormality or something symptom, then go to hospital and you will say to doctor, doctor, I have headache or I have pain for the heart. Then doctor will see for brain and heart. So more targeted. But health screening is what? Is a non-symptom person like you, like me, will come annually and to check full body. So basically, doctor, I have no problem, but maybe has some problem. So I have no symptoms, so that's why doctor cannot focus an area, only brain or heart. If doctor focus, then doctor can see the abnormality easily. But full body check, so doctor cannot focus anywhere. Everything he have to focus. So in this case, as human, sometimes mistake happen. Because, for example, in NURA case, we will make use ultra low dose CT from head to toe, make imaging. So thousands data will come. Doctor have to see everything in my body, without any focus. So basically, people might mistake. But we implemented AI and AI to pick up any abnormality. For example, compared to like a medium the person, this person has something wrong, something abnormal, highlight. And then doctor can focus here. Oh, this is yes, it's abnormal. Or no, this is normal. So doctor can decide without overlook mistakenly. So this is how we are implementing AI. So AI to pick up to alert to the doctor, and doctor see more focused and then decide by himself this is abnormal or normal. So this is a collaboration. So by this way, doctor can be faster can and without mistake, without overlook. So this is how we are using AI.
Wonderful, Morita. And I think it perfectly highlights how artificial intelligence isn't replacing medical expertise and professionals, but rather amplifying them and their presence and their skills. And this collaboration between doctors and intelligence systems seems to be shaping a more proactive and data-driven approach to healthcare, minimizing most of the errors that were or used to take place when we had a lot of human involvement and less of AI in the picture.
One more important point is, for example, we are facing in front of people, human.
Yeah.
So we cannot say you have something wrong because AI is saying something. It's impossible. Nobody can accept such kind of word. AI highlighted, doctor confirmed, doctor with responsibility is saying you have something wrong. Then people can understand, accept, then take next action. So always human to human is required in healthcare. This is no doubt actually.
Definitely, I agree with you, Amorita. And likewise, I think the healthcare sector also generates an immense amount of data daily, including patient records, diagnostic images, lab results, and genomic information, and the list is never ending. So, healthcare professionals often struggle with shifting through vast amounts of data to find actionable insights, which leads to delays, inefficiencies, and potential errors. Now, addressing data overload requires robust healthcare data analytics and advanced systems to streamline information and enhance healthcare delivery. So, in what ways are AI powered tools helping clinicians and doctors handle the growing volume of diagnostic data without overwhelming them?
So AI is again is a software. So this AI can be utilized in any way by technology because this is technology, so can change the way. For example, like in a screening case, I think it's a good way is AI start looking and then abnormality pop up and doctor can see. By this way, significant the doctor's time utilization will be increased and less overlook will come. This is a screening case. But for example, in a hospital setup, it's a more doctor AI together to look this problem because doctor also not perfect. So for example, he knows 100 cases, 1000 cases, but he doesn't remember million cases. But for example, AI can identify this image is looks like from here. So like dictionary, AI can bring some similar cases in front of doctor, and doctor will understand, oh, this is similar case, this is a similar case. So doctor and AI collaborate more to make more better decision. So this is also one of the way. Or sometimes is like if doctor also, for example, imaging is not a perfect. Sometimes to identify, decide this is cancer or not, it's a pathology is required. Is a more tissue diagnostic is required. In this case, doctor also can say this level, maybe this is a problem, but I'm not sure this is real cancer or not. But sometimes AI can say, I feel this is more canceristic area, for example, can advise to the doctor as well. So what I said is before doctor utilize, or together doctor utilize, or advice to the doctor. So it's a many way AI can be used. So in NURA, it's a screening, so it's a setup is different, but in hospital is different. But by this way, basically, we can make a good an decision we can provide to the doctor. So this is, I think, how to utilize AI and reduce the time and data. Yeah.
Absolutely. I think that's such an important point. With the sheer amount of medical data being generated every second, from imaging to genomics to patient records, I think it's incredible to see AI stepping in as a real partner rather than an overload. And what's also impressive is that AI, it's not about processing data faster, but actually helping clinicians make more informed and confident decisions, which is really needed at the right time. Moving ahead, In the rapidly evolving world of healthcare, the focus now is shifting from reactive care to proactive prevention. Now we have the emergence of wearable technology, and AI is at the heart of this transformation, empowering continuous health monitoring that predicts potential health risks before they become critical. Now, this shift from reactive to a proactive way is changing how we manage our health, and turning it from episodic care, where we only react when symptoms appear, into continuous care where we have early warn signings and insights are detected as fast as possible, helping us to take preventive measures and smarter decision making. So, preventive care is shifting from reactive to proactive wellness. How is AI helping identify potential health risks before they escalate?
So, for example, why Japanese people is long life? It's average life expectancy is 85 years old in Japan, but in India, 74 years old. What's the difference this 11 years? I think this is more come from health screening, preventive health, because annual health checkup is there in Japan, and everybody has to go. It's a mandatory. Everybody has to go. So we can find at the very early stage of the cancer. So if we even before symptom happen, so doctor can find this cancer and remove this cancer cell, small area. Then we can survive, no issue, because its cancer is not spread yet. So this is important as predictive healthcare, and we can find at early stage. This is important. But on the other hand, difficulty is what is everybody will go to center. Everybody in, for example, India now 1.5 billion population. 1.5 billion population can go hospital. This is not possible on the same time. So, for example, if in front of you 100 friend, who is a sick now is one or two. So healthcare setup is only for one or two people in front of hundreds people. But health screening or preventive screening is for everyone, so 100. So let's say 100 times of doctor, 100 times of hospital diagnostic center will be required if we want to cover everyone fairly. This is a difficulty. So how we can fix this gap is one of the way is AI and doctor collaborate 100 times faster way of the arrangement. For example, if doctor takes time for one view, in front of him 1,000 image, if he takes 100 minutes, but with AI, if he can make it 1 minute, then our current resource can cover such big number of population. This is the idea. So work efficiency and empowered doctor by AI, he can do more and more good service and more faster way to approach. So this is a way we are utilizing AI in NURA, for example. I think this is the correct way, right? I feel. Yeah.
Right, I agree with you, Morita, and it's really wonderful to see how AI is moving us from treat after it happens mindset to actually predicting and preventing health issues before they arise. I think that's very much needed when it comes to personal wellness and long-term healthcare planning, which earlier was very much impossible. But thanks to AI, we can now proceed ahead in this transformation and ensure that we are taking care of our health and give that much needed attention which it definitely deserves. Now, speaking of transformation, I mean, AI is definitely one of the key agendas as organizations explore its potential to transform healthcare, whether it's administrative task, revenue cycle management, or clinical decisions. AI technologies are redefining the boundaries of what's possible in healthcare. Yet, within this landscape lies the critical task of applying AI responsibly, a focus that will be central to ongoing discussions and advancement about AI integration into the healthcare experience. Now, the potential of AI comes with the responsibility of ensuring its implementation is transparent, trustworthy, and centered on human oversight. These principles form the core of responsible AI, which can further guide its integration into real world clinical settings to improve outcomes while inspiring confidence among clinicians and patients alike. So, as AI is becoming deeply integrated into diagnostics, how can the industry strike a balance between innovation and patient data privacy?
So it's not, I think it's not a start from AI. Actually, patient privacy policy, privacy information, this is from long time back, actually. In Japan, for example, it's a critically rule is there. In Europe also, it's a very strict rule is there. So basically, we have to follow the rule and we have to treat the patient data in a very safety manner. For example, if it's not only healthcare, like your data, for example, if somebody use freely, of course you will be angry. So at least your information should be removed, your personal information, at least. So that's why, like anonymization or pseudonymization, this kind of words came. Basically, for example, in a university or researcher want to use your clinical data, but your name shouldn't be there. So many company is developed anonymization tool or pseudonymization tool. For Fujifilm also same. Any healthcare data will go out from the hospital or diagnostic center. First of all, it's a patient agreement is required, number one. Number two, we have to remove the name completely, anonymization or pseudonymization. Otherwise, this data cannot go out from this center and of course cannot be used. So at least this kind of ethics arrangement is required for the patient data. And this become more strict rule in the world, even India same. So we have to follow. Yeah.
Right, definitely. With when we are trying to balance innovation with privacy, I think that's one of the toughest challenges in healthcare. But once we are able to have that balance, I think organizations can ensure both progress and patient trust go hand in hand. Of course, we need all the stakeholders involved, from government, policymakers to clinicians and patients, everybody to come together and ensure that we are respecting patient privacy, but also trying and boosting the advancements of AI in healthcare as much as it can give the real outcomes. Thank you so much, Morito, for taking out the time and effort to be on our podcast today and helping us understand that the entire healthcare landscape is becoming more data powered each day. Organizations that lead with a vision and integrity in this transformation will not only succeed in the market but also help create a future where medical care is not just about curing illness but actively preventing it and empowering every individual to manage their health. Thank you so much for your insights, Morito. It was lovely chatting with you.
Thank you very much. Actually, why I made NURA because I wanted to show how to utilize this technology AI in healthcare. So that's why NURA was created.
Great. Thank you so much, Amorito. This is for our listeners. I hope you enjoyed today's episode and gained some exciting insights around the role of AI and other technologies in healthcare. Stay tuned for our upcoming podcast. Meanwhile, you can view all our previous podcasts on Spotify and other leading platforms. Thank you so much.